First I'm going to take a craniocaudal x-ray of the radius and ulna. I've got AVMA here. So what I'm going to do is measure the area being radiographed. Right at 2 centimeters. So I'm going to set our machine. We have settings for bones, and I'm going to put in the 2 centimeter measurement. What that's going to do is going to automatically adjust my KVP and my mass, as we don't use the technique chart with this machine. I'm selecting a small film to use since the area per body that we're radiographing is small. And I'm going to put my right marker in since that's the leg that I'm going to do the picture on. I'm going to be positioning her with tape, and for collimation I'm going to go distal to the carpus and proximal to the elbow, centering the beam midline at the radius and ulna. I'm going to collimate down. And so over here what I'm going to do is I'm going to pull up her patient information.
Okay.
And now that my patient information is pulled up and I've got the image loaded, I'm going to put the cassette in and it will develop digitally. I'm going to be taking a VD chest x-ray of Archie here. And what I'm going to do is measure his chest and set the machine that way. I'm measuring at the widest point. That is 13 centimeters. So as we don't have a technique chart on our machine, we have settings for abdomen, bone, and thorax. So I'm going to set his thickness at what he measured at 13 centimeters, and that automatically adjusts my settings here. I'm going to lay him in the V trough. And I have my marker set to the right because his right side is facing us. I'm collimating. Okay. He's going to be centered at the midline down his chest, and I'm collimating from the thoracic inlet to the first lumbar vertebrae. Okay, and if you can extend his arms a little bit more, perfect. Get them a little tighter. There we go. And I took the picture at exhalation to get a maximum view of his lungs. got his name and account pulled up, and I'm starting the study in our software. And I'm adding his picture here, which is a VD thorax. Okay. Now I am loading the cassette, and it will develop digitally. Okay. Now I'm going to take my VD pelvis radiograph. I've got my patient sedated here, and I'm going to position her on her back and use the sandbag to help keep her spine straight. I'm going to measure her widest point on her pelvis. Which is 11 centimeters. So I'm going to set our machine to the bone setting. Set it on 11. And what this does is sets our KVP and our mass settings as we don't use the technique chart for our machine. I've selected a large film, and I've put my right side marker in. So the way I'm going to collimate this is to have the cranial border is going to be just cranial to the crest of the ilium. The caudal border is going to be just beyond the stifles, and I'm going to center it midline and at the level of the ischial tuberosities. Just feeling for the crest of the ilium here. Slide it just a little bit that way. Too far. Okay, so I'm going to take her legs in my hands, rotate her knees inward, and then pull down, keeping her as straight as possible. And I'm still going to go just a little more caudal. Make sure that I get her stifles in. Can you pull her towards you just a little? Okay. Now I'm going to take my cassette out, and what I'm going to do is pull up her account in our software. I'm going to add her film in, which is a canine pelvis CD. Now I can load the cassette. And the film will develop digitally. This is how you retrieve an image in our software, which is Dragonfly. So you can search for the patient information here. You can search by day. You can also do time frame. In this case, I'm going to search of all time, and I'm going to type in my last name and my cat's name. And so what I can do is select the images that were archived and pull them up. And these are from February. And this was chest x-rays that were done in an abdomen. This is Dewey. She's presented for vomiting. She's 14.5 kilograms, so we're going to be giving her 80 mils of barium liquid. She is going to get an upper GI study, which means she'll get a lateral and a VD x-ray at 0 minutes, 15, 30, and 60. So I'm going to give her the barium. Careful not to have her aspirate, and careful not to get it on her fur, which would show up on the x-rays. was the first syringe of 40, and we're going to do 40 more. She just finished ingesting the barium, so now we are going to take her 0 time picture. What's that? 13. And then next we will take a VD.
I'm Charlotte Hubertus. I'm the Associate Veterinarian at the Animal Clinic in Galveston, Texas, evaluating Rebecca Poplin on her radiology skills. As far as her strengths and weaknesses, I think one of her biggest strengths is her self-evaluation of her radiographs. When she takes an image, she usually is pretty good at being able to say, okay, that image is acceptable, and I'll send it down and let the doctors look at it, or that image is unacceptable, I'm going to need a new image. One of her weaknesses would be in her placement on the very first x-ray. She usually does have to take a second x-ray in order to get that right placement to make sure that we have the image that we need. But with her self-evaluation, that usually is not a big problem. So I'd like to see her be able to kind of get the x-rays the way we want them on the first try and collimate it appropriately on the first try. And that's improving as time goes on, but still something that we're working on. As far as other things that we've improved on, her ability to get her technique appropriate right away has improved vastly, and usually we don't have to change that at all after any of the radiographs. And her patient handling has greatly improved, and there's usually no issues with getting the animal restrained or getting the animal in position. And collimation is improving as time goes on to get it down to a more narrow field, and things are working really well for us. So overall, I think she's doing a really good job, and I really appreciate her radiology skills and knowing that when I send her up to take some x-rays, the images that I get sent down are 98% of the time going to be exactly what I'm looking for, and I can get my evaluation, and I'm not going to have to send her back up and with the patient again to get new ones. So really appreciate that. And I have a few little things to tweak and work on as far as placement and making sure that we get all of that correct. And as time goes on, I think she'll be doing really great. Thank you.